Hello, I'm Kelly Martin, Vice President IFA, and welcome to the IFA webinar on returning to the workplace, a discussion on strategies for reopening while protecting employees' mental health, sponsored by Paychex, an IFA preferred vendor. We welcome your questions during this time and have set aside some time at the end of the panel to respond to those questions. Please use the questions button on your application and we'll review those and present them to the panel at the end. We'll also provide a summary PDF of the slides and discussion following the webinar for those who have opted in. So we encourage you to opt in to receive that. I want to thank all of our panelists for joining, as well as those of you who have taken your time from your busy day to learn about this important topic. We're pleased to have Tom Baber, Christina Estrada, Jody Hansen, Joe Lindenmeyer, and Andrew Sperling, who are joined by our moderator, Tam Kennedy from Taco John's franchise. Tam, I'll turn it over to you and let you start the discussion. Thank you.
Awesome. Thank you, Kelly. Welcome, everybody. And again, let me echo our thanks for joining today on what we know is a very important topic. So let's start there. Let's talk about, this is kind of the return to the workplace. What we really want to focus on is something that doesn't get a lot of attention right now, and that is mental health. And we do know as business owners and participants in the franchising space that we've had some stress. We've had some changes. There's been a lot of disruption in what we would call our day-to-day, and something that we don't spend a lot of time on thinking about is how that really affects us and affects the teams around us, and what can we do about it, and should we have some plans in place and maybe start thinking about learning more about it. And so we put this webinar together because there's a need, and so excited to have the group of folks share with you today some great experts to walk us through best practices to help us understand more about the mental health space in the workplace and responsibilities around that. And then, of course, some examples of best practices and some examples about kind of how things have happened over this last year. So let's get started with talking first about probably the most important piece of this, which is the communication aspect, and how do we know if there's stress, how do we know when there's issues, and how do we communicate around mental health and employee and kind of our work family safety. And we're going to start with our friend Christina. Christina, it's been such a pleasure to get to know you. I'm really excited for you to share with everybody kind of the program that you put together to reach out to your entire system. Maybe share a little bit about your system and tell us about your communication platform on this issue.
Well, thanks, Tam. First of all, thank you to IFA and thank you to our sponsor, Paychex. Goddard Systems, Inc. is the franchisor of the Goddard School. We are the acknowledged leader in the premium early childcare and education market. We are headquartered in King of Prussia, Pennsylvania, which is a suburb of Philadelphia. And we currently license 560 Goddard schools across 38 states, and we serve 70,000 little learners. So yeah, wow. So, one of the things that we discussed is how a return to office, and in our case, a return to travel plan, because we have both corporate employees at our office, our headquarters. In fact, I am in our headquarters right now, but we also have our field staff that is in our schools each and every day. And so you can imagine, as the height of the pandemic was occurring last year, we resorted to a work from home, a work from remote environment. Every single one of our GSI colleagues operated from home. And certainly that emphasized the need to ensure the mental well-being of all of our colleagues and to also ensure their safety as we contemplated what we might do in terms of being able to return people to the workplace. And so we really focused initially on what our leaders could do with our colleagues, really being sensitive to everybody's daily routines were completely uprooted. People were balancing what was happening at home. Many of their children now were being schooled, at home. And all of this just created stress and anxiety. And so the first thing we needed our leaders to recognize is that let's take this one day at a time. Let's be super flexible. Let's be super accessible. Let's try to make sure that our teams are connected. We leveraged our technology. We have a Teams platform here, and we really ensured that we created virtual collaboration. And so, we did our best to stay connected, to try to handle the situations that were coming up. But we also wanted to be prepared. One of the things that I believe and the leadership team bought into is what minimizes stress and anxiety is that people have an appreciation and understand what's going to happen. And so while the pandemic created a lot of unknown, we said, what was it that we could begin to control and try to help? And that was planning for our return. And so by mid-June of last year, we had a plan in place. And that plan contemplated all of what was happening in terms of governmental guidance, CDC, what was happening at the state and the local levels. We also contemplated what was happening from a facility standpoint. We thought about what are some of the organizational needs that we needed to be in front of. And of course, how we were going to manage communications and keeping people apprised of how we were thinking about all of this. So our approach had three key principles. One was a tiered approach. We weren't going to necessarily ask everybody to come back all at once. We also wanted to make sure that we were staying apprised of what was evolving in the landscape, because everybody recalls there was a lot going on last summer and into the fall and into the holidays, and then after the new year. And the most important thing was that we focused on the use of data to help us make those decisions for our employees. And again, we shared all of this, we communicated all of it, and ultimately created a four-tiered approach. First tier, executives and volunteers. We thought it was important as a senior team to role model, what we believed was important to try to get back to some sort of new normal. Our second tier were our people leaders. And then our third tier, which is where we're at right now. So this week we've welcomed back our third tier here at the office. And that's a functional representation. So we can really begin to have face-to-face collaboration.
Right.
And in a couple of weeks, we'll have our full return. So go ahead, Tim.
I was going to say, so that feels very much like you built a plan and you're processing that plan against what you ultimately had hoped to put out as a way through it and a way forward. In terms of the stress and the communication around that, where you're at right now, tier 3, are your employees receptive to how this has gone? Has that plan being organized, has it helped? Are they grateful for that? There's bumps around technology and trying to have remote teams. We know that just today.
Yeah.
So how is that working for everybody now? The fact that there is a plan, is it broadly accepted in your system?
Well, again, we had been communicating this all along, but it's really heartening now that I'm in the office and able to communicate more directly with our colleagues. And they appreciate, first of all, we did a ton of things here in the building, cubicle extenders. We have a thermal scanner to make sure people have face coverings on. We also were very conscientious about making the vaccine a voluntary. We didn't mandate it. We have an employee pledge that everybody took to ensure everybody's safety here. I mean, we did so much and we got people prepared. We had knowledge checks to make sure that people appreciated. And so what people have now come into the environment saying to us is, wow, you said you were doing all of this. We see it and it feels good. And the thing that I hear from every single colleague that I've come across over the last several days is it feels so good to be reconnected and reunited.
And I think that
And
leadership, having your leadership put that plan together, you're seeing the benefits of that now. I want to talk to Joe and Tom as with two separate distinct brands. Joe, let's start with you. Tell us a little bit about how your brand kind of communicated the kind of how things were. Of course, we need to know a little bit about your brand, but was there a plan from your brand for you to follow in terms of how to maybe bring people back, and where are you at in kind of that structure?
Yeah, well, so Tam, one of the advantages I think that certainly we all have as being part of the franchise system within IFA, and with so many, great companies and best practices openly sharing things, right? We all move better together. We also have a mini subset of that within California Closets, which is my brand, but within First Service Brands. So there was a lot of activity at the corporate level, and having been a franchisor for 25 years, and now as a franchisee for the last 2, I definitely appreciated what they did to put that action plan together, to communicate, over communicate. When you're sick of saying it, people are starting to hear it. So you've got multiple layers within the organization that need to understand what the plan is. And I think as we saw, California Closets, and in my business as a franchise owner in the Gulf Coast, we operate in 4 states. They're similar in like-mindedness to a degree, but there's a lot of local and even state level differences that we had to maneuver through on the franchisee side of things.
Oh yeah.
And I think part of that was just, you mentioned it, and I know we're all going to talk about it, is the communication within your team, realizing you don't have all the answers, right, and that you don't know it all, and things can be subject to change. So you got to give yourself some of that flexibility. But in the reopening phase that I think we're all in now, our team is anxious to do it. Our clients are anxious to do it, but we're still very conscious of the fact that some people are still a little bit uncomfortable.
Sure.
With vaccination rates being what they are.
Sure.
It seems like most people that want it have it by now, but that may not be the case. But I know in our business, much like Christina, we made it optional. I did it and wanted to lead through that and communicated that through our team. But understanding there's different needs that we have. We have folks that are caregivers for elderly people and their family,
Sure.
and so being conscious of that was important to us. But one of the things in New Orleans, we were kind of on the tip of the spear with Mardi Gras and everything kicking off in February of 2020. So we kind of had to react to that pretty quickly, and with our corporate headquarters in California, they were really erring on the side of caution and on client favoritism, on what really the client wanted and how we could be client centric. We operate in showrooms and in clients' homes. So for sure, we're entering their private space, and we're going to be very conscious of that. And going forward, that's something that could still move a little bit. So we're being conscious of that too.
Yeah, I mean, there's just so many moving parts to this, isn't there? We were, we were all conducting business in one way, and then everything changed. And the stress of trying to know what to do and then teach what to do can really add some complications to being business owners, but also kind of the relationships you have with your team, your guests, your vendor partners, all of that. Tom, tell us just really quickly from your brand perspective, did you build a plan to keep everybody kind of advised in kind of best practices and where we're at, and were you able to give guidance and get guidance back and forth with your brand? You are muted, Tom.
I'm muted, yeah. I'll try to do this quickly because I know there's only so much time. So the 2 brands, I'll separate them, and I'll try to be as quick as possible. In IHOP, of course, it's customer facing, right? IHOP did a very, very credible job, as it sounds like Goddard and First Service did, of disseminating information. But the first thing we did is with the team and said, okay, we're going to do this together. You're safe. You're going to be safe. We're going to make sure that you're protected as our team members. And they, so we're all rallied around that. And some people wanted to do it, and some people would rather stay home. And that was good. We met everybody where they were at. And then it was all about how are we going to safely now serve the clients. Some of them want to come in and be 6 feet apart. Some of them want curbside. Some of them want to have plexiglass between their booths. And, instead of just doing plexiglass, we did really fancy stuff, right? And we made it really welcoming. So we took care of the team first, made sure that they knew they would be safe, worked with the ones who wanted to come to work. We bonused them and paid them and did whatever. And then together, we along with some really good guidance from IHOP, made an execution plan against meeting the customers wherever they were, right? And that was as big a part of the communication as anything else.
Sure. No, that's great. And we'll get some more examples from you here in just a little bit. Let's bring in Jody. I want to spend some time with, now, so Jody, she can share more. I mean, she's got more initials behind her name. Look at that, than anybody that I know. Super impressive, but really one of our experts today. We have two experts, but one today, Jody, has some best practices that she's going to talk about a little bit in terms, particularly around communications and how we have to handle those. And I mean, it starts from a nucleus, right, Jody? And then the communications kind of go out as a spider's web. They go everywhere, and trying to get that right. Talking about this in the right way is huge. So Jody, share with us a little bit in terms of communications from your perspective.
Sure. You know, from an HR perspective, I think the biggest tip that I would give employers and folks that I work with is, you know, if you see something, say something. So I think that, you know, the folks who have already shared on the call today have given some really great strategies for returning people to the workplace. But I think that there's also an opportunity for employers to keep their eyes open and identify situations where employees may be struggling. And I think that there has kind of been this prevailing, you know, I guess, attitude in the past about, you know, kind of I'm repurposing this phrase, but the don't ask, don't tell policy. So if I see an employee struggling, I don't really want to say anything because that might like open a can of worms or open Pandora's box. But what I would tell employers is, you know, if you wait to start a conversation with an employee who seems to be struggling, sometimes waiting can lead to negative outcomes. And I don't want to be too graphic, but sometimes employees take actions that can't be undone. So it's important to have those conversations. And what I always tell clients is just keep in mind, if you don't say something and then something happens with that employee, whether it's outside of work or in your workplace, there's going to be some residual guilt, right, about whether or not you should have taken different action.
So, Jody,
yeah,
that fine line that you're talking about should we cross over and ask, you know, how are you doing? Or you seem a little disengaged today. Like there are real, as an employer, those are hard questions to really bring yourself to ask, mostly because you don't want to invade somebody's personal space or privacy. But also you don't know if you're breaking the law by asking, and it's a very difficult kind of tenuous space to be in. And then the employee as well, they're not sure if there's enough trust to actually bring something to you. So is there, I know we're going to talk about ADA implications, but when you say, if you see something, say something, what's a good way to approach that? And we're going to lead this into stress and anxiety as it becomes clear in the workplace. What are we looking for? What are some signals we should be aware of?
Sure. So one thing that I'll keep referring to what I like to tell clients. So what I like to tell clients is, you know, it's important to have the conversation with the employee. If you're uncomfortable, then maybe talk with somebody who, you know, you like a trusted advisor or a colleague or someone that you feel comfortable with to say, I've got this situation. I'm not quite sure how to approach it. They may have some suggestions on how you can do that. But what I would say is keep the conversation more general instead of assuming that there is something, you know, that might be considered a disability or might be considered a mental illness going on.
Sure.
So what question I would generally ask my clients is if they came to me and said, I've got this employee and they seem to be struggling, and I would ask, well, have you talked to the employee? And a lot of times they would say, well, I sent an email, or, you know, they know I've got an open door policy. And I would say, no, did you talk with your mouth? So that's what I always like to ask clients is, if you're having an issue with an employee, did you talk to them with your mouth? Did you find out what's going on? And did you position it as, what can we do to help you, right? So instead of assuming or judging or being, you know, inflammatory or like I said, we don't want to come at it from a place of being judgmental. It's more,
Sure.
It looks like you may need some help. What can we do to support you? What can we do to help you? What do you need from us in order to succeed in your role?
No, I think that's amazing. And so, we've got all of us can say, I think today, that we have seen that stress manifest in the last year, either in our families, in our workplaces, out in the commercial world. We've seen it. And so knowing when and how to approach that, I think, is important. And we've got here a little bit later, we're going to share some resources that I think will be invaluable to everybody. Let's talk about, what that stress and anxiety looks like. So Tom, you and your kind of your other hat that you wear, you've got some preventative strategies that you put in place through Money Mailer, not only with just the corporate team, but the franchisees, talking about stress management, anxiety management. Share with us a little bit, would you please?
Sure. And Jody, I'm sure you would agree, because we're not in the IHOP and Tam in tacos, you can see the people when we're working remotely. Sometimes you're not on Zoom, and facial expressions and body language tend to tell you as much about as what someone's saying. So we try when possible in a one-on-one to have the video on so we can try to pick those up if there's any issue. I think mostly what we do is we keep a really open environment. So Tam, I'll try to do this quickly on the Money Mailer side, but I'm going to give a little background because I think it's important. Money Mailer went through a transaction with our parent company, Local Marketing Solutions Group, in April of last year, right in the middle of COVID, right?
Right.
So you had all these people that used to work in an office who are now working remotely, who now also are going through a transaction. There's a lot of uncertainty and stress and so on. But our, as a parent, our company has a strategy around execution and not necessarily where the companies are located. All the acquisitions were about a goal rather than where they're located. So prior to COVID, they were, except for a small office in Chicago, 100% remote company by necessity because the acquisitions weren't all together. So that helped because that informed on how to work remotely. Then we took the entire Money Mailer team, and at least now we're going through this together. I had been a franchisee for a long time and helped quite a bit on the corporate side. So now the transaction is happening in a very difficult time during COVID, but we're doing it together, right? So there's not, because I wasn't an outsider, it helped a huge amount. So now we take the team and we say, okay, let's put the teams back together. We're not going to be going back to an office. What can we do? Well, one, we communicate on Zoom as an entire group, and there's a fair number of us, at least once a month. And then the team leaders, it depends on whether it's a manager or one of the chiefs, depending on the size of the team. They'll do a meeting once a month, but that's more for fun, right? They'll do, we use something called Jackbox Party Pack, and it's run on a Steam software, and you're getting together and have a good time. But that is all because you can learn and see and reflect, and they can't be back together, right? So they play a game for a while, and then they hang out for a while, and they do whatever. And it's an hour and a half, normally done during work hours, but not always. It's really up to the team because I don't want to stress someone out on their non-work time. But we knew what we were dealing with. We had some, employees with four kids at home homeschooling while they're trying to work. And sometimes when you're on a call or on a group call, it gets a little loud in the background, and they'll mute and unmute, and we go, look, it's good. We got you. It's fine. Like, don't worry about it, And we just took each person through that together. And I think our team feels really great about sharing, so we do not end up with communication issues. And if they can't do it on our large calls, they seem to be comfortable on their small calls. And if a manager sees something, they'll do a one-on-one.
So keeping it open, keeping it lively, but also keeping it connected seems really kind of the way that you have managed making people realize, I think, that you're all in this together. Yeah. And sometimes it does feel, that you're isolated, especially the remote work and things like that. Certainly I can vouch for you. Had my granddaughter in our office for a good bit before we even got back to even remote schooling. She now, she answers the phone. She's 10, and she's pretty much in charge of our office at this point. She orders lunch, and she, has her own locker. And so having to real time run my business with and get her on her, get her on her school platform on time, all of that, I can relate 100%. Plus keeping them, you have a responsibility to everybody in your life over this. Stress is a real issue in normal times, but particularly now. Joe, I'm going to turn to you. Tell me some, really, I know I know you to be a very kind person, but you've seen this. You've seen this prior to your work life, and you've seen this now, kind of in the business. Give us some examples of some interactions that have been tense, and kind of what you're learning and how you're handling that.
Yeah, well, you mentioned, Tam, obviously I'm not a trained scientist or a physician in this field, but you know people, and you know your team, and you know when stress builds up. And in the military, obviously, we talk, and there's a wide range of studies and discussions around PTSD, and it'll be interesting to see what happens long term if this kind of falls in that area for a lot of folks. And I think Andrew's probably going to talk about that a little bit. But for us, when clients are in their home and, they're seeing us load material in and out of our vans, and it's 95, 100, 105 degrees, 100% humidity, and they've got masks on, but because of the sweat and just the work, the mask drops down, and a client got very upset about that, called me, and our team member swore that he had it on the whole time. And, if it just fell off, well, you're not going to argue with the client over that. And if they saw their mouth, they shouldn't have. But, having compassion, listening to the clients when they want to vent about that, but also, talking to your team about it and realizing that this isn't a fatal flaw for them if something like that happens. Mistakes happen. We can't throw good people out because of circumstances that were out of their control. And we talk about that a lot. We talk about, the crisis ready culture and how we handle that and what's built into our DNA and into our culture around it. And for us, I think this was a test of a lot of those things. We rush to the conflict, whether it's a client that's upset or a team member that has an issue. I loved what Jody said. Talk with your mouth. Don't text, don't email. That's the easy way out. But there's going to be follow-up questions. There's going to be people wanting to make sure that they're heard through that.
Yeah.
And we've really built that into our team, but our clients also know it and they appreciate it, and they have access to anybody in the company. That's the other thing. We don't filter through certain channels. If they want to get to me in a call because they feel they need to, I give out my cell phone. Our team knows that they can do that. I'll meet with them. Those are the things that I think are important.
I love that you call it a crisis ready culture. I think there's a whole lot of people 2 years ago, a year and a half ago, that wish they would have known that or known what that could mean to us as business owners and participants in all of our lives. I think, who knew, I guess, and we're learning, right? But I love that you stay with the problem all the way through. You're following up. It sounds like if there is an issue, you're looking at it from both sides. You never want to lose good people. You certainly don't want to lose clients, customers. There's always three sides to the story, right? Each of the parties, and then the actual what happened. There's that third piece that really, it's hard, and that causes stress. That employee goes home and is stressed at home and thinks that they failed you, and the client is stressed because they think now maybe they chose wrong to do business with someone, and it's very difficult to manage. Andrew, I'm going to bring you in here. Andrew is one of our other experts. I'm very excited to have you join us, Andrew, and share with us some of that expertise. First of all, make sure that you tell us kind of who you are and where your expertise lies, and who you're partnered with right now. And then maybe share with us a little bit some of those valuable resources as we're looking at this anxiety and stress situation in our lives.
My name is Andrew Sperling, and I'm with a group called the National Alliance on Mental Illness. We're the largest national membership organization representing people living with mental illness and their families. So we provide support groups to people living with a mental illness in their family. We have education programs. We have 600 organizations all across the country, in every state except for West Virginia, and but we're trying to build that one back up again. So we're a national organization with a large following, and we try and be a resource in local communities, helping people coping with a mental illness. So we know that over the last 15 months, we have seen elevated levels of stress and anxiety. For example, a survey by the Centers for Disease Control in June of 2020 found that 31% of respondents reported symptoms of anxiety and depression. 13% initiated or increased use of substance abuse. 26 reported stress-related symptoms. 11% even had serious thoughts of suicide, and that was over the past 30 days of that measure just a year ago. These numbers are double the rates we would have expected to see before the pandemic. As in prior studies, this survey showed that the risk for reporting anxiety symptoms and suicidal ideation included food insufficiency, financial concerns, loneliness, lots of things going on here. But I also want to observe Dr. Tom Insel, who ran the National Institute of Mental Health for more than a decade, up until a couple of years ago, he coined the phrase normal reaction to abnormal circumstances. So let me sort of posit the idea. I think we can all agree the last 15 months have been anything but normal, okay? But experiencing anxiety, experiencing stress, increased use of drugs and alcohol, that is in many respects a normal reaction to abnormal circumstances. And on the good news here is that the vast majority of people that experience these symptoms, resiliency is going to kick in and they're going to get better. They are not going to tip over to having symptoms lasting for 4 or 5 or 6 months to the point where they have a diagnosable anxiety disorder or depression or PTSD. So that's the good news. The challenge is finding those, identifying those individuals for which these symptoms seem to persist for 4 or 5 or 6 months, and intervening as early as possible to change that trajectory. We know that early intervention works. So that's the challenge we have, is finding those individuals where resiliency hasn't kicked in and getting them the help they need. So I think we have in the chat or somewhere a link to our colleagues at Mental Health America. They actually have an online self-assessment tool for anxiety and depression and other symptoms of mental health conditions. And we encourage people to use that online resource tool. And again, it's self-administered. You can go there on your own, and you as employers can urge your employees that where you identify stress to use those potential online tools to help. And you can see what some of those others are there as well.
So many good ones, Andrew. That is, those statistics that you just shared are frightening, but they're real. This is a real situation that is happening. And for everybody that is participating in the webinar, watching, viewing, and I hope that are posing some questions for us to get to here in a little bit. There's boundaries that we're always, we think we're seeing something, and it might even be us that are really kind of hyper challenged around perfection and being able to handle everything and being kind of in a leader's role, but taking care of others is just as important. And so you kind of move some priorities aside and you focus on others, even though the stress is building in you. I love that there, and I know we have a link to that we can take this, I'll call it anonymous, but a self-diagnosis or a self kind of a screening, and maybe that could lead to understanding why maybe we feel that way. Question for Jody. Jody, how does this, let's just say that I wanted to share this link with all of my employees. Is that a good idea as a business owner to say, hey, we're coming through some stressful times. If you have an interest, here's, a list of resources, or here's a link. How does that work in the HR world? Where am I at with my boundaries?
I mean, I think it's fine to share that type of information and resource, as long as it's made clear that it's voluntary and that the company isn't collecting the information, because obviously if you collect anything that has personally identifiable health information, it falls under HIPAA, and you have to make sure that you're protecting confidentiality. What I would suggest is, in addition to something like this, if you don't offer some type of employee assistance program, that is probably something that would be of benefit to employees. it's not just about, identifying mental health issues. I mean, there are all kinds of other benefits that an employee assistance program might bring to bear. As a result of the pandemic, people might be experiencing financial constraints. So having a program that offers referrals for financial assistance, like Paychex has one called FinFit. So basically gives people access to a financial advisor. Concierge services. So if people need assistance finding childcare, finding care for an elder parent, or finding care for someone with special needs, if they need help, refinancing their home, if they need help, let's just say finding a veterinarian, that takes a specific type of insurance. Like, they're all different types of benefits that an EAP can provide, and it provides that additional layer of anonymity. So employees typically will feel a little bit more comfortable using a tool like that.
Hey, Tam, Jody, sorry, Tam. I'm really glad you brought that up, because I meant to mention it and I forgot to, and we found that a very valuable tool for us. The EAP has been used for us.
So it's, stress doesn't have to be because of work or returning to work or happening at work. Whatever the stress is, it's there. And as stewards of our teams, we want to try to help. And so having these resources available and kind of knowing what direction to take. I always feel like you can never go wrong with having empathy. We have to be careful about, like you said, the documentation pieces and things like that. But having these a wealth of support out there in the world through government or non-government entities, getting to those places, having these resources available is a really good first step. And I think a lot of employers really don't even understand that even those that might have health insurance coverage, they should look at that and make sure that there's a mental illness or something similar to that kind of clause. And if it's not there, start shopping for it, because your employees may need it now, or they may need it for some other reason. Andrew, other resources that you'd like to share that you think in terms of those struggles, we've got the great link, but how else do what other areas could we share with everybody that's viewing today that could be helpful?
Well, I think you definitely need to engage your health plan. So nothing is more challenging for an employer than you've identified someone with a problem, you have good quality benefits for your workers, and then they go to the health plan website and they find out that none of the psychiatrists or mental health professionals in the plan's network are taking new patients. That's a big problem, and we've struggled with this in our field. We passed a law back in 2008 requiring that mental health benefits be on par or at parity with medical surgical coverage, but we still haven't reached that goal. And I think many of your employees experience that when it's fairly easy to find a primary care physician that's taking new patients, a pediatrician to see their child, but when their child or adolescent has a mental health problem, an anxiety disorder, it's very, very difficult to find a mental health provider in the network. That's a problem and a challenge that you really need to work with your health plan on to make sure that when you identify a problem that there's treatment and other resources available to help that your employee and their family.
I love that. I think it's so obvious today that there's a need. And it's unfortunate that this situation, these circumstances, brings that forward. There's always been a need. So our franchisors, our franchisor supplier friends that are viewing this, let's get to work on this. Let's try to figure out how we can build some alliances around mental health. Joe mentioned PTSD. We don't know. We're still in this. We don't know what this is going to look like for any of us down the road, but we know how we feel right now. I'm going to use this last few minutes together to talk about each other, talk about a little bit about those kind of, I always call them those touchy-feely kind of sensitive areas that we as maybe business leaders kind of avoid, and that's self-care. Got to take care of yourself. Can't take care of your team if you're not taking care of yourself. And you very often, I can look at everybody and know that you put yourself last sometimes, and there's so many people depending on you. Let's talk a little bit about self-care in the respect of how, what are you doing to find a way to take a break from all of this. Joe, give us something that you are doing right now personally where you're breaking away from work, whether it's mental clarity break or is it a physical distancing thing, or what are you doing to keep yourself kind of ready?
Yeah, well, a couple things. I hate running unless chased or have a ball in my hand, and I have found that running has been one of those things that it really does hurt, but it makes me not think about what's going on with work, and just working out for me is important. But Tam, just if I can mention one other thing, I think a lot of us, and maybe a lot of folks listening, are part of that generation where something happens and you're told to stand up, dust it off, walk it off, didn't hurt. Right? There's that mentality that we have to be conscious of, that this next generation wants to share more, and they do it socially. And one of the things in our business that we're finding is that we're all together on Facebook now. Like, there's people that I would probably never have sought out that have sought me out. And my philosophy is, hey, I'm going to be transparent. I'll be an open book, and I have a personal life, but we all know those collide together a lot. And we see a lot of things. So we talk about peer mentoring. We talk about our next level of leadership, being able to engage with people. And it can't all be on us, or it can't be on the C-suite or the owners of the business. I think we've got to be able to build a team that also communicates together and that is there for each other. And that brings that team tighter. That we've gotten so tight during this whole experience. And people are wanting to spend more time together and socialize. And with that comes the opportunity to learn a little bit more about what's going on in their personal life. Not always that you want to seek it out, but it's something that comes about. And I think if we have that open dialogue, we learn a lot more and can help more in that way too.
I think mentoring is huge. Those peer-to-peer connections can be so invaluable. We have made new friends, and we've strengthened relationships with our old friends as well. And we all look forward to getting back to being able to see each other face to face. Christina, jump in here. You're just an elite brand taking care of all of our future, all the kids. That cannot be without stress for the leadership team there. How are you finding a way to enjoy yourselves? How are you taking breaks individually, or are you doing any group activities? Talk to us a little bit about kind of the stress relievers. Those stress balls, they don't really work very much anymore. Mine are shredded. So what are you doing to kind of let some steam off?
Yeah, so let me first start at that personal level. I think one of the most important things that I've learned is practicing gratitude. At the onset of the pandemic, I woke up every morning being thankful that I felt well and that those around me that I loved the most were also well. And then I kind of expanded that out in terms of what I found each day to be really grateful. And I found that it just gave me this whole different perspective. So I just offer that from a personal perspective. We also recognize that for our franchisees, what they were dealing with throughout this pandemic was just incredible. And so what could we do to help them? And so we curated something called a SelfCare library. We were fortunate we had access to experts and so forth. And it was a series of articles, it was a series of podcasts, it was a series of other techniques to just sort of get back in touch with yourself to, as you pointed out, Tam, so that we could continue to take care of others. We had families to take care of, we had our little learners in our schools to take care of, but we really wanted our franchisees to know that as a franchisor, we know that it's important to take care of yourselves as well. So we did that. We also did with our own teams. We actually did a well-being happy hour during one of our town halls. And we actually collectively did a mindfulness exercise in our various breakouts. We did that virtually. So, we tried a lot of different things, and it's really about finding what works best for you.
Sure. There's a variety. So we've got some physical activity, which we know through health professionals really does work. We know mental exercising, gratitude, kind of the looking inward helps a lot. Andrew, I can't imagine the stress that you have, particularly now. Would you just give us one little bit, and then we'll turn it over to Jody, and we're going to do some Q&A. What are you doing, Andrew, to stay focused on yourself through all of this?
So I've been fortunate that my office is one time zone away. I relocated to the central time zone for this pandemic. So I always have at least an hour and a half at the end of the day when all my Zoom calls are over, and I go walking, and I really just relaxes, and I'll play some, listen to a podcast, and it's a good way to relax.
Yeah, I think that's
what
great.
I worry about is actually, Tam, it's not so much, those of us that have jobs that we've been able to do remotely through Zoom calls. I really worry more about the IFA members whose businesses were essential and had no choice but to continue, and how they manage that stress. That to me is a bigger challenge. And I don't have all the answers, but I know that there's a lot of creative members out there in the IFA membership that have how they've had to keep their employees motivated when they had no choice. They could not shut down.
Yeah, that would be me. We never closed a day. We never took a day off. We were closed. That's not true. We were closed for Christmas Day. In many cases, we were the only restaurant open for 4 or 5 miles because so many people just shuttered. There's a lot there. We don't have enough time to talk about all of that. But we are finding ways to. We got to take care of the physical. We got to take care of the mental. And we got to make sure that if we're as strong as we can be, we can kind of look for those signs in the teams that we're working with. And Jody providing us with all of those resources, I think was super helpful. Kelly, I know there's been some questions come in. Let's see if we can't tee up some of those questions for this great panel. Lots of expertise here from different perspectives, but even if somebody's looking for some ideas, I'm sure any one of us would be able to jump in and help. What do we have?
Great, thank you. And thanks to all the panelists for sharing your professional and personal experience with that. It's both amazing and impressive. Watching all of you deal with your different lines of businesses and how you showed so much care for your employees and your customers. It's extremely gratifying for someone who works for your association to see that. It makes it easier for me to get up in the morning and go to work every day. So first question I would bring up is moving forward with flexible work schedules, splitting between the office and the home. So at first I'd ask Christina, how did Goddard Systems corporate office approach deciding how to decide whether to allow flexible work schedules and what you're actually doing?
Yeah, so as part of the transition plan, we are operating with a hybrid. So 2 days at home and 3 days in the office. So that was all part of our transition. And again, something that we created. We always had a work from home policy, and we're continuing to evaluate what's going to make sense. I think we've all recognized an opportunity to continue to get smarter about what's important. And we've learned a lot from the pandemic. I mean, I always say sometimes these, very intense situations do create an opportunity to learn. And I think for many of us, that's what the pandemic created in terms of different ways of working. So we're looking forward to continuing that evaluation.
Thank you. And Jody, do you have any insight into across your clients, what they're doing? Is that similar to what other clients are doing, or is there anything you can add to that?
With respect to flexible scheduling, I think that it makes sense to, not adopt a one-size-fits-all policy. It's really going to depend on the nature of the position, the productivity that's required, the systems that are required. And, I think that there are a lot of other considerations in terms of, some people's kids aren't back in in-person school yet. So if you're mandating everybody come back to the office, what are those folks going to do? So I think that a lot of clients that I've worked with have kind of been of the opinion, well, we've always done it this way. So as soon as people can come back to the office, they should. And that's not always the best answer. So I think each situation needs to be looked at individually and kind of determine what's going to be best for that person, what's going to be best for that position. And if they can allow a flexible schedule or work from home arrangement, then we would encourage them to do so.
Thank you. Another question, and I'll direct this to Andrew, which is, how do you try to identify mental illness early on? What are some things that employers can do? Some tools for them to look at, checklists or references, or just other examples that they can do to be observant for either mental illness or extreme stress with either their employees or their families.
So we mentioned earlier several online self-assessment tools. Mental Health America has one. There are more resources at the website of the National Institute of Mental Health. But it's really identifying the symptoms as early as possible.
Thank you. This question I would direct to
Kelly,
Tom. Oh, go ahead, please.
Sorry, this is Jody. I just wanted to just kind of dovetail on that. As an employer, if you start to see certain signs and symptoms, it may indicate that you need to have a conversation with the employee. Things you might start to see would be things like absenteeism, especially around the weekends. That might indicate that there's a substance abuse issue going on. If you start to see a lot of turnover, specifically maybe in one department, that's something that might indicate that there's something with the manager that needs to be evaluated. You may start to see decreased productivity. A person is just not available for calls. They aren't responding to voicemails or emails. You can also start to see behavior issues. And behavior issues sometimes can escalate to workplace violence if they aren't addressed. So again, those are some of the things that as an HR professional, I would advise managers to look out for. And if you start to see trends with absenteeism or turnover or productivity or behavior issues, then I would suggest that you have a conversation with the employee and find out what's going on.
Jody, that's awesome. This is Tam, and I would just tell you that the behavior issues are really key indicators for us because we're public facing. When we have employees that are normally happy, coming into work happy, leaving happy, bubbly, and we see more than just one shift where they're withdrawn, quiet, we know something's not right. And so we're careful about how we ask it. We want to make sure that they're okay. And normally it's not about work. It's about something that is happening at home. And I will tell for everybody's benefit, there was a time, probably about 3 or 4 months, May through the summer last year, where a lot of our 18-year-olds and 19-year-olds were the only ones working in their household. Both mother and father were out of work because their businesses closed. They didn't have jobs. And so there was a lot of pressure on young people to provide. And we worked with all of our employees. We did weekly meal kits for every employee to take home, whether they needed them or not. But we started seeing the acting out the opposite way, which is snapping at a customer, raising their voice, kind of slamming different pieces of equipment around. So physical, like indicators that they're unhappy where maybe they weren't. So we have looked for those changes from what was regular. We look for those as well. I hope that helps a little bit.
Mm-hmm.
Thank you. We have probably a much easier question for Tom. What was the name of the game that you used?
Yeah, that is an easy one. Jackbox Party Pack, and we run it on Steam software. And you can tell I'm reading that off my cheat note because I never would have remembered. And just give me 15 seconds to plug IFA. In our Money Miller business, both on the corporate level and the franchise level, we deal with a lot of SMBs, small, mid-sized businesses. The IFA information on a myriad of levels, whether it was PPP or about 100 other topics, we regularly shared those with the franchisees to share with their clients. We regularly shared them with our own clients. And it helped their stress because a lot of them were going through things they didn't know what to do. And they weren't fortunate like all of us to have the IFA resources that we do that Joe mentioned before. So well done, IFA. You did a great job of packaging, and I think, did a really nice job of sharing it.
Absolutely. Kelly, we have time for one more.
Thank you. And I'll direct this to Joe. Especially since your business requires you to go into customers' homes, how are you having discussions potentially with your staff about vaccinations?
Yeah, so obviously this is continuing to evolve, but we've been open with our team that we would like them to be vaccinated. I got vaccinated. We've had several other key members, but we know that some people just aren't going to do it, and they've told us that. We're not going to take the hard line that they have to be vaccinated or else they can't have a job with us. There's a lot of other things that are at play, and I think the science is evolving. We're still doing our health and wellness checks. We're doing temperature checks. We're having them, wear masks in clients' homes. And it is a question that I've got, and we're all going to be a lot smarter in about a year from now, looking back on this to see how this all worked out.
Great, thank you.
Well, everybody, I just want to say thank you to Jody and Christina, Andrew, Tom, and Joe, and to you as well, Kelly. This is as important a discussion as we could have, and one that I don't think we've had before. And so we thank Jody and Team Paychecks as a preferred vendor for IFA for sponsoring this, and all of the members of IFA for leaning in together, learning from each other. It's been a real pleasure to spend some time with all of you. Know that there is a recording of this. It'll get posted out there you'll have access to this for those that joined us today. Kelly, I'll leave it to you to just wrap it up for everybody, but thanks from me.
Thanks, Tam. You did a great job of wrapping it up. And again, thank you to all of our panelists. Thank you to everyone who listened in, taking the time from your day. We'll turn it back to you, and everyone have a great and safe day. Thanks again.
Please be well.
Well done, Kelly. Bye, guys.
Bye-bye.